We are so delighted to welcome Dr. Olufikayo Bamidele.
Thank you for having me. I'm delighted to be part of this. Thank you so much.
Oh, thank you. Could you please introduce yourself?
Yeah, thank you. Let me start by thanking the organizers of this project and my colleague who kindly invited me to be part of this important initiative. I'm very grateful and I feel really honored to be part of it. So my name is Olufikayo Bamidele and I'm currently a research associate at the Hull York Medical School at the University of Hull, United Kingdom. I had my first degree in microbiology at the University of Ado-Ekiti in Nigeria. And after that, I had a master's degree in public health at the University of Bedfordshire, also in United Kingdom. And after that, I had the Vice Chancellor's Research Scholarship to go to Ulster University, where I did my PhD degree. And my study looked at the post-treatment experiences and psychosocial needs of Black men and their partners after treatment for prostate cancer. So that's me in a nutshell.
Oh, thank you so much for sharing your experience. Then could you tell us your current research interest and what made you passionate about pursuing that career?
Thank you. So my research interest and experience have broadly focused, around addressing health inequalities in cancer survivorship, outcomes, and experiences. And I'm particularly interested in high risk but under researched groups like ethnic minority groups, particularly. So most of my research has focused around addressing that and also looking at how gender culture intersections impact on how people experience health and also in terms of their use of healthcare services. And I think my research has, important implications for nursing practice, especially when you look at the aspect of cultural sensitivity in healthcare practice and delivery.
From your perspective, I know like UK, not just UK, but globally with this current COVID-19 pandemic, nurses have been undergoing with a really challenging time. How do you think nurses' leadership can be enhanced during this challenging time? If you have any thoughts, could you please share?
Yeah, thank you. I think the first message I would like to pass across to nurses, both current nurses and future nurses at this time, is to let them know that they are highly valued and honored. I think this pandemic, on a good day, nurses are doing a fantastic job. But I think what this pandemic has taught is just further showcase, the phenomenal work and the roles that nurses, and healthcare professionals generally that they play in ensuring our health and well-being as a society. So my first message, to nurses at this time is just to, feel that honor, that value, in themselves, that this is a noble profession, that nurses are doing. I mean, I have friends, I have colleagues who are nurses, and I'm amazed. I've been amazed at their response, their resilience, during this pandemic and how they've kind of, coped, with it, how they are, putting even themselves at risk, even to be able to take care of other people. I think that cannot be quantified in words and cannot be underrated. So that's the first message I would like to put out there, to nurses, that you're doing a fantastic job. And I just want to say thank you, for that. And going on, just reflected on the pandemic, and also my own research experience, in terms of working with ethnic minority groups and in relation to cancer care, and also as a user of healthcare service myself. Because even though I'm not a nurse, but I've had interactions, with nurses and I've used healthcare services. I think one thing I think we need to think about even more currently and in the future is around cultural sensitivity in healthcare, delivery. And I think, especially when you consider that, the multicultural nature of patient demographics, diversity, because of the migration patterns, things are really changing, demographics are changing. So I think it's essential, going forward that we kind of inculcate or incorporate that cultural sensitivity in healthcare delivery in terms of interaction with patients, in terms of communication with patients, in terms of how we perceive users of healthcare services. I think that's really, really important. And an example is because of the lockdown, the travel restrictions during the pandemic. Some people have had to be locked down in countries where, longer than they had planned to. And in the course of that, they might have had to use the healthcare service, in an unfamiliar setting. So, it's really important as leaders and as future leaders to be dynamic in responding, to those diversities in the patient, cohort. And I think that's really important. And I'll just elaborate a little bit on that in terms of cultural sensitivity, because somebody will think like, okay, so how do we achieve that? And I think there are two tips that I would like to give to, nurses current and future. And that's self-awareness and open-mindedness, okay? So in terms of being self-aware, it's just about being aware, consciously aware of one's character and feelings, and how that could also be perceived by others or influence interaction with other people. So I think it's really important for nurses, to be aware of their own potential biases and stereotypes. It's not about doing away with your own cultural perception or background knowledge, but it's being aware of it and how that can influence interaction with patients, with healthcare users and all of that. And I think one of the lessons we've also learned from this pandemic is, how it has kind of highlighted how people can be touched in different ways, regardless of their ethnicity, regardless of gender, regardless of socioeconomic status. Everyone has kind of been touched differently in different ways. And I think it's really important to recognize, those diversities, be aware on how those things can impact on how we relate, with our patients or services or healthcare, users, so that it doesn't interfere in the care that we give. It doesn't, mask, the quality, of the care that we give, right? So apart from being self-aware of those potential biases and stereotypes, I think it's also important to be aware of your strengths and your weaknesses as well. I think that's really important because when it's about being aware of your strengths as a nurse, your strength, your psychological strength, your physical strength, so that you can maximize the strength, because it takes a healthy nurse, healthy physically, healthy mentally, to be able to take care of the patient. And I think sometimes because we're healthcare professionals, where we can want to just feel like we are all good all the time. And when we need help, we might not, necessarily ask for it. So I want to encourage nurses that when you need help, feel free to embrace help, feel free to ask for help, to be aware of when you need to, maybe take a rest, take a break, so that you can recover, so that you can also be fit, so that you can be able to take care of your patients even better. Yeah. And the second thing I want to also point out in terms of achieving cultural sensitivity is that open-mindedness. It's really important as future leaders for nurses to be open-minded. I mean, for reasons that I highlighted earlier on in terms of diversities in patient cohort, but also because going forward, that is the future. And there's so many things we've learned. There's so many changes that have come to stay as a result of this pandemic, in terms of how we relate to patients, in terms of consultation. For example, I won't be surprised if after this pandemic, some patients will prefer maybe telephone conversation or consultation and won't be so, enthusiastic to go back into the clinical, setting. You might get this. So it's about being able to embrace some of those changes that have come, to stay as a result of this pandemic. Be open-minded to other people's opinions as well, to other people's perception, and that is when you can empathize, with them, and you can, be able to give them the care that would touch them in very special, places. So, for example, a nurse that is maybe working in a particular location, for example, and you can understand, you have an idea of the demographics of the patients, that are there in that particular location. You can be open-minded, maybe to learn a few things, a couple of sentences, for example, that you could use maybe when you're maybe something around thank you or how are you, and just little things, gestures that just show to the patient that you actually you're culturally sensitive, that you're able to appreciate where they're coming from, and also and all those things beyond the professional expertise, they go a long way in also touching the patient in a good way and making them feel really loved and cared for. But overall, nurses are doing fantastic jobs. And I think, yeah, those are just additional things to consider even for the future as leaders.
Thank you so much for a powerful message. Like so many things like came in. I like my heart is shaking right now. Like in terms of diversity, I truly agree because with this pandemic, I think it revealed that how diverse the world is. And in terms of like self-awareness and open-mindedness, yeah, these are also two like key things that we nurses all need to have. I feel like sometimes people are really hesitant to change their stereotypical mindsets and like not able to like be totally open mind, or like they keep on believing their stereotypical thoughts. Like if they're like they're from your experience, if you have any thoughts, like how can we just start like supporting these members to include being self-awareness?
Yeah, thank you. And I think it starts with, I mean, a project like this that you are doing. This is like a first step in even creating, that awareness and that sense, around what are the attributes, or the qualities, that nurses need to develop going forward. So I think this particular initiative is a very good step, in that direction. And I think there needs to be increasing awareness and training as well, with increasing training and awareness. And I think the great thing about this initiative is how you have brought different speakers from diverse backgrounds, to kind of, bring in some insight. So I think that again, it's a form of, training and educating, nurses to embrace that. So I think that's really important. And I think if nurses can also explore the strength around empathy. Empathy is around treating others the exact way you would like to be treated, right? So that helps to, because everyone wants to be respected. You want your opinion to be appreciated or to be recognized. It's not about good or bad or right or wrong, but it's about, being recognized, being respected. And if you're able to put yourself in that shoe of another person, I think it helps to be open-minded. It helps you to be able to embrace other perspectives, other ideas and opinion. Yeah, so basically it's about education, it's about training, projects like this, and empathy, and just developing some of those qualities. And again, it's about exposure reading. I like reading because it helps me to also understand other people's culture and other people's way of thinking and all of that. So that could also be another avenue for nurses to improve that quality.
Oh, thank you. Yeah. Yeah, maybe like it's really important for like members to take initiative and include them and change as and become an organization culture. Yeah. Wow, thank you so much.
Yeah, I think just, I mean, what I could just add is
Yeah.
just that, being open minded doesn't mean you're discarding your own belief system or the things that you value. Well, it's just being aware of them and being able to make a change when it is necessary, for the good of, either your patients or your colleagues, or you understand. So that's just basically what it's about, being open minded. It doesn't necessarily, because I think that could be what could be a barrier sometimes. People might think, oh, because I want to be open minded or I need to show cultural sensitivity, then I need to put aside my own belief system, my own values. Well, that is not necessarily what it's about. You still have your own values, you still have your own thinking, but it's just about being open to other people's opinions and ideas as well. And if there is need, to change or to adapt, to a particular context, to tailor service, to suit a particular, patient, for example. So it's about individualized care in a way, just to, be able to get a win-win. It will still be a win-win, because I think ultimately what nurses want to achieve is just to make the patient feel good, be happy and all of that. And in doing that, I think there's a reward, satisfaction that comes, to nurses as well, and to healthcare professionals, and even us as researchers as well. It's when we see the impacts that we're making on people that we feel also rewarded and satisfied as well. So I think that's really important as well to think about.
Yeah, especially in the post COVID-19, like after this settles again, people like go to each other's countries as ever than before. And then there's like multicultural, and there's another group dynamics. And yeah, I definitely think that your message is
Absolutely.
really important for future nurses leaders. Thank you so much.
Thank you. Thank you for having me. Thank you. And thank you for the great work you're doing. It's
Oh,
fantastic.
thank
And I
you.
can't just say thank you enough.